One of the first things that we notice about someone is their smile. But there are millions of people who are missing teeth and are embarrassed about their smile. Dr. Olawoye, along with his highly trained and caring team at Hunterdon Oral Surgery, offer dental implants and full mouth rehabilitation using the latest cone beam CT technology and implant planning software to restore your smile.
So people could be losing teeth from a variety of reasons. Cavities, that's dental caries, periodontal disease, trauma, and even congenitally missing teeth. The WHO has made edentalism, meaning the lack of teeth, a disability. Very much so, just like if you're missing a limb, if you're visually impaired, because you're losing the ability to be able to do one of life's functions, everyday functions, which is chew, to masticate your food.
Today, dental implants are the best option for replacing missing teeth.
A dental implant is a biocompatible titanium screw that's implanted in the jawbone, and after a period of time, usually 4 to 6 months, it integrates, meaning it fuses with your bone or jawbone, and your dentist can then attach a base or an abutment, and then your crown or tooth gets screwed in or cemented into that.
We learn about dental implants and full mouth rehabilitation.
Over the last couple of years, our focus has really been on full mouth rehabilitation. This is where a patient has an entire failing dentition or multiple teeth that are non-salvageable. It again involves a clinical exam, radiographic exam, taking a cone beam CT, so that we can come up with a treatment plan. And I'm sure a lot of people have now heard of the all-on-4 treatment modality, where a patient comes in, we're able to extract the remaining teeth that are not very good, not very healthy, and place implants. That same visit, we're able to take teeth that have already been set by your dentist, like denture teeth, and screw them into those implants so that the patient never leaves the office without teeth. After a few months of healing, then they take that and are able to take a mold and make the final prosthesis. It restores the patient's full function and aesthetics in as little as a couple of months.
I had a full mouth rehabilitation from Dr. O, and I feel great. I feel better now than when I had my real teeth.
Hunterdon Oral and Maxillofacial Surgical Specialist. Advanced dental implant technology combined with compassionate care equals a positive patient experience.